The Ellipta is a dry powder inhaler, or DPI, that contains multiple doses of medication within this case. Before using the Ellipta, make sure the counter shows available doses. Do not prime this device. Wait until you're ready to take the dose before opening the cover, because once the cover is opened, a dose is loaded and ready to be inhaled. Hold the Ellipta upright and slide the cover down to open the device, to expose the mouthpiece and the air vents, and to load the medication like this. Never shake the device because the fine dry powder may spill out. If you accidentally drop it after loading the dose, then you must start over because the powder likely spilled. Holding the Ellipta with both hands like a hamburger, but away from your mouth, breathe out gently but completely. Never exhale into the Ellipta because you may blow out the powder. After exhaling away from the device, seal your lips around the mouthpiece, but do not cover these air vents with your lips or fingers, and do not use a spacer with the Ellipta. Inhale one long, steady breath through your mouth until you take a full, deep breath like this. Move the device away from your mouth. Hold your breath for at least 3 to 4 seconds, but up to 10 seconds or as long as possible. Then breathe out slowly. Close the inhaler by sliding the cover back over the mouthpiece as far as it will go, and make sure it clicks shut like this. If the Ellipta contains an inhaled corticosteroid, rinse your mouth, gargle, and spit. Do not swallow, to reduce the risk of a fungal infection in the mouth called thrush.